Anxiety and panic attacks are often spoken about as if they are the same thing. People use the words interchangeably, saying things like, "I had a panic attack all day," or "my anxiety suddenly hit me out of nowhere." While anxiety and panic attacks are closely related, they are not the same. Understanding the difference is important because it helps people recognize what they are experiencing, seek the right kind of help, and feel less afraid of their own symptoms. Mental health conditions are common, yet misunderstood. Anxiety disorders affect millions of people worldwide, and panic attacks can be one of the most frightening experiences a person can go through. When someone doesn't understand what's happening in their body and mind, the fear can become even worse. Today, we're going to clearly break down anxiety and panic attacks, explain how they differ, where they overlap, and what you can do if you or someone you love experiences them. Let's start by understanding anxiety. Anxiety is a natural human response. It is your body's built-in alarm system. When you perceive a threat, real or imagined, your brain activates the fight or flight response. Your heart rate increases, your muscles tense, your breathing becomes faster, and your mind becomes more alert. This response is designed to protect you from danger. In everyday life, anxiety can be helpful. It can motivate you to prepare for an exam, meet a deadline, or stay alert in risky situations. However, anxiety becomes a problem when it is excessive, persistent, or out of proportion to the situation. Chronic anxiety can interfere with daily life, work, relationships, sleep, and overall health. Anxiety often builds gradually. It may start as worry, uneasiness, or nervousness. Over time, these feelings can intensify and become constant. People with anxiety often describe feeling on edge, restless, or unable to relax. Their minds may race with what-if thoughts, constantly anticipating negative outcomes. Physical symptoms of anxiety can include muscle tension, headaches, fatigue, stomach problems, nausea, sweating, and trouble sleeping. Emotionally, anxiety can cause irritability, difficulty concentrating, fear, and a sense of losing control, though usually at a manageable level. Now let's talk about panic attacks. A panic attack is a sudden, intense surge of fear or discomfort that reaches its peak within minutes. Unlike anxiety, which tends to build slowly, panic attacks appear abruptly and often without warning. They can feel overwhelming and terrifying, even when there is no real danger present. During a panic attack, the body's fight or flight response goes into overdrive. The physical sensations are intense and can mimic serious medical emergencies such as a heart attack or stroke. This is why many people experiencing their first panic attack end up in the emergency room, convinced they are dying. Common symptoms of a panic attack include a racing or pounding heart, chest pain or tightness, shortness of breath, dizziness, shaking, sweating, nausea, numbness or tingling, chills or hot flashes, and a feeling of choking. Psychologically, panic attacks often involve intense fear, a sense of impending doom, fear of losing control, fear of going crazy, or fear of dying. One of the most defining features of a panic attack is its intensity. While anxiety can be uncomfortable and distressing, panic attacks are usually described as unbearable at their peak. They typically last between 5 and 30 minutes, although the aftereffects, such as exhaustion or lingering fear, can last much longer. Now that we've defined both, let's clearly compare anxiety and panic attacks. The first key difference is onset. Anxiety usually develops gradually and is often linked to ongoing stressors or worries. Panic attacks, on the other hand, come on suddenly and peak quickly, often without an obvious trigger. The second difference is duration. Anxiety can last for hours, days, weeks, or even months. It may fluctuate in intensity, but remains present in the background. Panic attacks are short-lived but intense, typically peaking within minutes and then subsiding. The third difference is intensity. Anxiety is often described as a constant hum of worry or fear. Panic attacks are like a full-volume alarmant, hence overwhelming and hard to ignore. Another difference is fear focus. With anxiety, fear is often directed toward future events or ongoing problems, work, health, finances, relationships. With panic attacks, the fear is often focused on the symptoms themselves. People fear that the racing heart means a heart attack, or that dizziness means they will faint or lose control. Despite these differences, anxiety and panic attacks are deeply connected. Anxiety can increase the likelihood of panic attacks. People who live with chronic anxiety are often more sensitive to bodily sensations. A small change, like a faster heartbeat or shortness of breath, can be misinterpreted as dangerous, triggering a panic attack. After experiencing a panic attack, many people develop anticipatory anxiety. This means they begin worrying about having another panic attack. This fear can lead to avoidance behaviors, such as avoiding crowded places, driving, exercising, or being alone. Over time, this can significantly limit a person's life. When panic attacks become recurrent and are followed by persistent fear of future attacks, a person may be diagnosed with panic disorder. Panic disorder is different from generalized anxiety disorder, though the two can coexist. Let's talk about what happens in the brain and body during anxiety and panic. Both anxiety and panic involve the amygdala, the brain's fear center. When the amygdala perceives danger, it signals the release of stress hormones like adrenaline and cortisol. These hormones prepare the body to respond to threats. In anxiety, this system is activated frequently or stays partially activated for long periods. In panic attacks, the system is triggered suddenly and intensely, even when there is no real threat. Importantly, panic attacks are not dangerous. They feel dangerous, but they do not cause heart attacks, strokes, or death. The sensations, though frightening, are the result of temporary changes in breathing, heart rate, and muscle tension. Understanding this fact alone can reduce fear and help people cope better when panic strikes. Now let's address common myths. One major myth is that panic attacks mean you are weak or losing your mind. This is false. Panic attacks are a physiological response, not a character flaw. They can happen to anyone, including strong, successful, and mentally resilient individuals. Another myth is that anxiety and panic attacks can simply be snapped out of. While mindset and coping strategies help, these conditions often require understanding, patience, and sometimes professional treatment. Let's talk about management and treatment. Both anxiety and panic attacks are highly treatable. Lifestyle changes play a foundational role. Regular exercise, adequate sleep, balanced nutrition, reduced caffeine intake, and stress management techniques can significantly reduce symptoms. Practices such as mindfulness, meditation, deep breathing, and yoga help calm the nervous system. Cognitive behavioral therapy, or CBT, is one of the most effective treatments for both anxiety and panic attacks. CBT helps individuals identify unhelpful thought patterns, challenge catastrophic thinking, and gradually face feared sensations or situations in a controlled way. Exposure therapy, a form of CBT, is especially effective for panic disorder. It helps people learn that panic symptoms are uncomfortable but not dangerous, reducing fear over time. In some cases, medication may be helpful. Antidepressants such as SSRIs are commonly prescribed for anxiety disorders and panic disorder. Anti-anxiety medications may be used short-term under medical supervision. Medication is not a failure. It is a tool that can help stabilize symptoms while other coping skills are developed. If you are experiencing anxiety or panic attacks, seeking professional help is a sign of strength, not weakness. Finally, let's talk to those who are currently struggling. If you experience anxiety, know that you are not alone. Your feelings are valid and help is available. If you have panic attacks, remember this: a panic attack cannot harm you. It will pass, even if it feels unbearable in the moment. The fear of panic is often worse than panic itself. Learning the difference between anxiety and panic attacks empowers you. When you understand what's happening in your body and mind, fear loses some of its power. With the right support, education, and tools, people can and do recover, leading full, meaningful lives. Mental health awareness starts with understanding, and understanding begins with honest conversations like this one. Anxiety usually develops slowly and steadily, often starting as mild worry or uneasiness before gradually intensifying. It tends to grow in response to ongoing stress, unresolved problems, or repeated negative thoughts. A person may begin the day feeling slightly tense, then notice their mind constantly anticipating what could go wrong. Over time, this persistent worry accumulates, making the body remain in a state of heightened alertness. Because anxiety builds up gradually, people are often aware of what is causing it, such as work pressure, relationship issues, health concerns, or financial stress. Even when the source is unclear, the feeling of anxiety usually lingers in the background, increasing little by little rather than appearing all at once. Panic attacks, in contrast, arrive suddenly and with intense force. They often occur without any clear trigger, catching the person completely off guard. Someone may be sitting calmly, watching television, walking, or even sleeping, when a sudden wave of fear and physical symptoms hits them. Within minutes, the body reacts as though it is facing extreme danger, even though no real threat is present. This unexpected onset is one of the most frightening aspects of panic attacks, as the person has no time to prepare or understand what is happening. Because panic attacks appear so abruptly, many people believe something is seriously wrong with their body or mind. The suddenness can make the experience feel uncontrollable and overwhelming. Unlike anxiety, which gives some warning through rising tension and worry, panic attacks feel like a switch has been flipped instantly. This key difference in onset explains why anxiety often feels manageable, while panic attacks are described as shocking and terrifying, especially during the first experience. Anxiety is often long, lasting, and can remain present for extended periods of time. It may persist for hours during a stressful day, stretch into weeks during difficult life situations, or even become a constant companion for months or years. Rather than coming and going quickly, anxiety tends to linger in the background, sometimes intensifying and sometimes easing, but rarely disappearing completely on its own. A person with anxiety may wake up already feeling tense, carry that uneasiness throughout the day, and go to bed with the same restless thoughts still circulating in their mind. This prolonged duration can be exhausting, as the body stays in a heightened state of alertness for far longer than it is designed to handle. The extended nature of anxiety often affects daily functioning. Concentration becomes difficult, sleep may be disrupted, and even simple tasks can feel overwhelming. Because anxiety lasts so long, people may begin to see it as part of their normal state of being, forgetting what it feels like to be fully relaxed. The constant presence of anxiety can slowly wear down both mental and physical health, contributing to fatigue, irritability, and burnout. Panic attacks, on the other hand, are brief but intense episodes. They rise rapidly, usually reaching their peak within a few minutes. While the experience feels endless in the moment, most panic attacks begin to subside within 20 to 30 minutes. After the peak passes, the body gradually returns to a calmer state, though lingering sensations such as shakiness, tiredness, or emotional vulnerability may remain for a short time. This difference in duration is crucial. Anxiety is like a slow, steady current, while panic attacks are sudden waves that crash and then recede. Understanding this can help individuals recognize that panic attacks, though terrifying, are temporary and will pass. Anxiety is often experienced as a steady sense of worry, tension, or unease that remains present over time. It may feel like a constant mental pressure, where the mind repeatedly focuses on concerns, potential problems, or negative outcomes. Physically, anxiety can show up as muscle tightness, restlessness, shallow breathing, or a knot in the stomach. While these sensations are uncomfortable, they are usually manageable, allowing a person to continue with daily activities, even if those activities feel more difficult or draining than usual. The intensity of anxiety tends to rise and fall, but it rarely reaches a point where a person feels completely overtaken by fear. Panic attacks, in contrast, are marked by an extreme surge of intensity that can feel overpowering. The fear that comes with a panic attack is sudden and overwhelming, often described as a feeling of total loss of control. The body reacts as if it is facing immediate danger, flooding the system with adrenaline. Heart rate increases dramatically, breathing becomes rapid or feels restricted, and the person may experience dizziness, chest pain, or a sense of detachment from reality. These sensations can be so severe that individuals believe they are having a heart attack, suffocating, or about to collapse. What makes panic attacks particularly frightening is not just the physical symptoms, but the emotional intensity that accompanies them. The fear is absolute and consuming, leaving little room for rational thought in the moment. Unlike anxiety, which often allows some level of coping or distraction, panic attacks can feel impossible to manage while they are happening. This stark difference in intensity explains why panic attacks are often remembered vividly and feared deeply, while anxiety, though distressing, is more often endured as a constant, ongoing struggle rather than an acute crisis. Anxiety is largely driven by thoughts about the future and concerns over situations that have not yet happened. The mind becomes preoccupied with what-if scenarios, constantly scanning for potential problems or negative outcomes. A person experiencing anxiety may worry about upcoming responsibilities, possible mistakes, health issues, relationships, finances, or social interactions. Even when there is no immediate threat, the fear is directed toward imagined future events. This type of fear keeps the mind stuck in anticipation, making it difficult to stay present. The individual may replay past experiences or mentally rehearse future situations in an attempt to gain control, which often increases anxiety rather than reducing it. In anxiety, the fear is usually connected to external circumstances or internal thoughts rather than immediate bodily sensations. While physical symptoms may be present, such as tension or fatigue, they are not typically the main source of fear. Instead, they are seen as side effects of ongoing stress and worry. The person's attention remains focused on the potential consequences of future events and the desire to prevent something bad from happening. Panic attacks shift the focus of fear inward, toward the physical sensations occurring in the body. During a panic attack, the fear is not about the future, but about what feels like an immediate threat happening right now. The racing heart, shortness of breath, dizziness, or chest tightness become the center of attention. These sensations are often misinterpreted as signs of serious danger, such as a heart attack, loss of consciousness, or loss of control. This fear of the symptoms themselves creates a feedback loop, where fear intensifies the sensations, and the sensations increase fear. This difference in focus is critical. Anxiety fears what might happen, while panic attacks fear what feels like it is already happening inside the body. Anxiety affects the body in a gradual and ongoing way, often creating a constant state of physical discomfort rather than a sudden crisis. Because the body remains in a heightened state of alertness for long periods, muscles may stay tense, leading to aches, stiffness, and headaches. Digestion is commonly affected, causing nausea, stomach pain, or changes in appetite. Sleep disturbances are also frequent as the mind and body struggle to fully relax. Over time, this prolonged physical strain can result in fatigue, weakened immunity, and a general feeling of being worn down. The physical impact of anxiety may not always be dramatic, but its persistence can significantly affect daily comfort and overall health. Panic attacks, on the other hand, place the body under sudden and intense stress. When a panic attack occurs, the nervous system releases a surge of adrenaline, preparing the body for immediate danger. This can cause the heart to race or pound violently, chest tightness or pain, rapid or shallow breathing, dizziness, sweating, shaking, and a sensation of choking or suffocation. These symptoms are often so severe that they closely resemble those of serious medical emergencies, such as heart attacks or respiratory problems. The extreme physical sensations of a panic attack can be terrifying, especially for someone experiencing one for the first time. Many people seek emergency medical care because the symptoms feel life-threatening. Even after the panic attack subsides, the body may feel drained, shaky, or weak, as if it has just endured a major physical event. While panic attacks are not physically dangerous, their impact on the body feels intense and alarming in the moment. This contrast highlights how anxiety slowly wears down the body, while panic attacks overwhelm it all at once.